In this video, we'll be talking about eConsult and its adoption within Ontario. Canada's healthcare system relies heavily on primary care providers, also known as PCPs, and does a pretty good job of making PCPs accessible and available to the general public. But the country is struggling with long wait times to see a specialist, which leaves the referral process almost saturated. In fact, among the 11 Commonwealth countries, Canada has the longest wait times to receive specialized care, with Canadians having to wait more than 4 weeks on average to see a specialist. Long wait times have serious consequences on health outcomes, such as increased pain and even transforming potentially reversible illnesses into chronic, irreversible conditions. Not only do health symptoms generally worsen during this lengthy wait, but when Canadians finally get through to see a specialist, the first visit often involves prescription of further tests to be done. This means that almost no progress has been made towards a diagnosis, let alone a treatment plan. So how can we potentially tackle this pressing concern? Well, luckily through technological innovations in the field of e-health, Ontario is trying to implement eConsults, which are a form of communication between specialists and PCPs. Instead of PCPs referring the patient to an in-person visit, the PCPs can just send the electronic request to a specialist through a secure platform. The PCPs can ask for advice ranging from, does this patient need an in-person visit, to what is the best course of action to take to diagnose or treat this patient? And if the specialist believes the patient requires an inpatient visit, they can even specify what tests must be completed before the first visit. With eConsult, specialists are expected to reply to requests within a week, but the average response time is only 3 days. And that's not all. Not only do eConsults reduce the time it takes to receive specialist care, it can also help to avoid them altogether. By speeding up engagement between family physicians and specialists, patient experience is improved by enabling timely feedback and often eliminates the need to travel long distances for an in-person specialist visit. As impressive a tool as it may be, eConsult still has a long way to go before reaching every clinic and hospital. First of all, since it's a new technology, many doctors don't know enough about it, while some others are resistant to the new technology and the changes it may bring. Many others are worried about how this will affect their relationship with the patient and the impact on privacy, quality, and continuity of care. So what can we do to tackle these challenges? This brings us to our next question, which is what options do PCPs and specialists have when adopting eConsult, and how can Ontario increase the awareness and adoption rates? Well, to answer this question, we first need to determine the eConsult landscape in Ontario. Ontario has 3 eConsult pilot projects across the province. The first is the Ontario Telemedicine Network, or OTN, Teledermatology, which is a province-wide system enabling consultation between PCPs and specialists in the field of dermatology. The second eConsult system is the OTN eConsult, which enables PCPs to consult with 23 different specialists in Toronto Central, Southwest, Northeast Local Health Integration Networks, or LHINs. The third eConsult system is the Champlain Building Access to Specialists through eConsultation, or BASE eConsult service, which is specifically implemented in the Champlain LHIN and enables eConsultation between PCPs and 95 different specialist groups. Recently, the Champlain BASE eConsult system was implemented in the Mississauga-Halton LHIN, demonstrating its value and generalizability within Ontario. From these pilot projects, an Ontario-wide eConsult initiative called the Ontario eConsult Program was created and allows requesting PCPs to consult with a group of consultants through OTN Hub, which is a secure web-based eConsult platform. In addition, Ontario MD is working towards an electronic medical record, or EMR, integration initiative to allow access to eConsult through EMRs. Currently, only 2 EMR vendors provide the eConsult function, Oscar and Accuro EMR. With this initiative, Ontario MD is providing vendors with requirements necessary to integrate with the Ontario eConsult program. So now physicians have a choice to make. Do they choose the standalone eConsult through OTN Hub, or do they choose an EMR integrated eConsult? Both have advantages and disadvantages. Two aspects of standalone versus EMR integrated eConsult we'll be discussing are interoperability and access to medical records. Challenges surrounding interoperability arise considering the integration of eConsults into EMR, as different incommunicable EMR systems have been adapted Canada-wide. Workflow disruptions will be prevalent when EMR systems differ between PCPs and specialists, obstructing the benefits of the eConsult system. And secondly, EMR integrated eConsults enable complete access of medical records to specialists and eliminate medical record abstraction. This is a primary weakness of standalone eConsults, requiring further research into the necessary mechanism for the inefficient sharing of medical records. Each form has its unique advantages and disadvantages, and healthcare systems will need to consider and anticipate any changes that come with incorporating technology into their workflow. However, remember the EMR integration initiatives we talked about? Well, it turns out that the requirements Ontario MD will provide vendors will ensure that the eConsult developed within each EMR will be able to talk to each other. This means that even if PCPs have a different EMR than specialists, they will still be able to send eConsults to each other. Thanks to this, when your favorite EMR wants to obtain eConsults, they will have specifications to follow to make sure that Ontario remains connected. Moving forward with the implementation of eConsults in Ontario, gaps in literature and understanding of the program may cause challenges and issues to arise. For instance, for PCPs with Accuro and Oscar EMR systems, there's a lack of information on how to access and use eConsult. Furthermore, eConsult is a health IT system that is fairly new in Canada, and therefore specific barriers PCPs and specialists will face when interacting with either forms of the program are unclear. In addition, there is sparse information about health and financial outcomes of eConsult in Canada. And finally, research regarding the scalability and expansion of eConsults across Ontario remains unaddressed. There are some recommendations for physicians and specialists, EMR vendors, and Ontario to increase the adoption of eConsult. Starting with some recommendations for physicians and specialists, it's highly recommended that they start to take an initiative to consider using an eConsult system. Research has shown that PCPs are satisfied with the timeliness of meeting specialists and the educational value they gain from their eConsults. If you're a PCP or specialist who has Oscar or Accuro EMR, you should consider an EMR integrated option. However, if you don't have these two EMRs, you should still consider the standalone eConsult option. Considering that one of the goals of Ontario MD is to keep all the eConsult systems interoperable with one another, all the systems will be able to communicate with each other, no matter if you're using an EMR integrated or standalone eConsult system. It is recommended to consider factors such as eConsult or e-referral extensions when choosing a vendor for EMR, as they can be extremely beneficial in the long term. Now we're going to move on to some recommendations for the vendors. For vendors that are certified by Ontario MD, a documentation regarding how to integrate eConsult into their existing EMR systems will be provided in spring of 2019. It is recommended that these vendors prioritize incorporating eConsults into their EMR and anticipate necessary changes when the integration document is released. For Accuro and Oscar EMR systems, currently there is no promotion or acknowledgement of the eConsult program on their website or any of their social media platform. It is highly recommended that marketing of the eConsult program is present on their website and awareness of the functionality is promoted through the vendors to increase adoption rates. As for recommendations for Ontario, it's recommended that Ontario MD invests more in marketing techniques to ensure that both PCPs and specialists around Ontario are aware of what eConsult is. It is also recommended that they focus on making the eConsult implementation process as seamless as possible to increase the implementation rate of eConsult across Ontario. Thank you for listening, and I hope that this video has motivated you to bring more attention to e-consultation. So next time that you're in a doctor's office and you find that you need to see a specialist, maybe bring up the idea of e-consult as an alternative.